It is an absolutely nasty infection.
Rising measles cases threaten the virus's elimination status in the U.S.
You could learn CPR and, you can save a life just as good as Superman.
How Buffalo Bills safety Damar Hamlin is advocating for heart health and improved emergency response to cardiac events. And drumming up support for new research to help ease symptoms of Parkinson's disease. Welcome to Eye on Health, where we focus on stories that affect your physical and mental well-being. I'm Michael George. The number of measles cases in the U.S. continues to rise. The CDC has warned the uptick during the first quarter of this year threatens the country's elimination status. Nicole Skanga has more on what's contributing to the spread.
The CDC is concerned that measles infections continue to rise in the United States. As of April 18th, 125 cases were reported in 17 states so far this year. The vast majority occurring in people who are not vaccinated or those whose vaccination status is not known. Nearly half of all cases are children under 5.
Parents, unfortunately, are withholding their children or delaying their children from being vaccinated against this disease.
Dr. William Schaffner with Vanderbilt University Medical Center says measles is the single most contagious virus we know. He warns there's a misconception among some parents that it causes only mild illness.
It is an absolutely nasty infection, and I would not wish a single child to have to experience measles.
Health officials are warning of a possible exposure at the Indianapolis Children's Museum during the solar eclipse after an infected person from out of state traveled there for the viewing. Anyone exposed could show symptoms as late as April 29th based on the incubation period. Symptoms are high fever, cough, runny nose, red eyes, white spots in the mouth, and a rash that starts on the hairline and face and spreads.
The measles virus can get down into your chest and cause pneumonia. Even more seriously, it can get into your brain and cause inflammation.
Doctors say the best way to avoid infection is to get vaccinated. Nicole Skanga, CBS News, Washington.
The FDA says traces of bird flu have turned up in some samples of pasteurized grocery store milk. This could mean bird flu is more widespread than previously known in U.S. cows. But the agency expressed confidence the milk we buy is still safe to drink. CBS News medical contributor Dr. Celine Gounder says so far there's no reason for concern.
The tests that came back positive are for the genetic material of the virus. This could just be virus fragments, what's left over after pasteurization. And so this by itself is not a reason for alarm.
The FDA says more tests are being conducted to ensure any virus fragments found in the milk supply are inactive. A New Jersey patient became the first woman and the second living human to receive a kidney transplant from a pig. Her heart and kidneys were failing, prompting doctors to use a first-ever approach for a second chance at life. Chief Medical Correspondent Dr. John LaPook reports.
When you came into the hospital, how sick were you?
I was pretty much done.
At age 54, Lisa Pisano's heart and kidneys were failing.
I couldn't go up the stairs, I couldn't drive, I couldn't play with my grandkids. So when this opportunity came to me, I said, I'm taking it.
When we admitted her to the hospital, she had 2 cardiac arrests. So that's how close she was to death.
Dr. Robert Montgomery heads up the Transplant Institute at NYU Langone Health. With FDA permission, he and his team decided the only way to save her life was with a first-ever approach, giving her both a mechanical heart pump and a kidney transplant from a pig.
About to do something that no one has done.
The human immune system rejects organs from animals, but Dr. Montgomery and his team used a pig kidney with one gene altered to make it more compatible.
How did you know that the kidney was working?
So you release the clamps and Lisa's blood goes into the kidney and it suddenly turns this beautiful pink color, a healthy organ. This isn't just about keeping somebody alive, it's restoring them to their lives.
How are you feeling today?
I feel great today compared to other days.
As she recovers from surgery, Pisano dreams of playing with her 2 young grandchildren for the first time in years.
What's the scene look like? Draw it for me.
My granddaughter's, Gemma, come on, running around in the backyard. My grandson's getting into anything and everything he can get into, trying to do it both. And it's a wonderful scene.
The transplant team hopes the one-gene edit technique will make it easier to breed enough pigs to supply kidneys for more people on the transplant waiting list. Dr. John LaPook, CBS News, New York.
The NFL draft was this week, and heart health has taken on greater significance in the NFL after Buffalo Bills safety Damar Hamlin suffered cardiac arrest during a game last year. Wendy Gillette shows us how Hamlin has become an ambassador for improved response to cardiac emergencies.
Bills safety Damar Hamlin has returned to life as normal, on and off the field. But now part of his daily routine revolves around his heart after he suffered cardiac arrest during a game in Cincinnati in January 2023.
Make sure you take preventative measures, get screening and, just check up on your health, but also know the, reactive measures.
Hamlin recently took part in an event in New York City as captain of HeartMates, a partnership with the medical device company Abbott to build a community of those who know the struggle of heart conditions, including 8-year-old Tony Daly from Las Vegas, who underwent surgery to close a hole in his heart when he was born premature.
We like to think of him as our miracle baby and as a way of spreading it back to everybody that may be in a similar situation.
Hamlin's cardiac arrest on the field helped a national TV audience see the importance of access to defibrillators and learning how to perform CPR.
You could learn CPR and, you can save a life. You're just as good as Superman.
Cardiologists say it's also imperative to keep your heart healthy, so emergency steps won't be needed.
The simple stuff really matters, and so blood pressure, blood sugar, cholesterol, staying active, not smoking, eating a healthy diet, maintaining good stress levels, sleeping well.
That resonates with Lakeisha Brown from Houston, who developed advanced heart failure and received an Abbott heart device. She sees how Hamlin's heart crisis has improved awareness.
People are becoming more aware. If they're not feeling well or that type of thing, they'll go to the doctor, I think, a little bit more.
She knows firsthand that taking action is vitally important to recovery. Wendy Gillette, CBS News, New York.
Last year, heat-related illness caused more than 120,000 emergency department visits. As we get ready for those warmer months, the CDC has a new tool to help Americans beat the heat. It's a new dashboard that includes a heat risk map and an air quality index. CDC Director Dr. Mandy Cohen unveiled the technology.
You can put in your zip code and see current heat risk and air quality levels and a 7-day heat risk forecast for your area. So you can plan your day and you can plan your week with your health in mind.
You can access the dashboard at cdc.gov/heat risk. Keeping kids safe is a parent's #1 job. But are overprotective parents actually hurting their children in the long run? Julie McDonald spoke with a Boston College professor who says evidence shows modern parenting goes too far.
We are so afraid of the kinds of dangers that are actually so rare that we're not allowing our children to prepare themselves for the bumps in the road of life, and then later on they fall apart.
Boston College research professor Peter Gray believes increasing rates of teen suicide, anxiety, and depression are linked less to screens and more to limitations on children's freedom. He wrote in the Journal of Pediatrics how a hovering obsession over safety from strangers and speeding cars has caused different harm.
They are far better off if they have the kinds of experiences in which they learn how to judge danger themselves, how to solve their own problems, develop a certain degree of courage, learn how to deal with the small amounts of fear and anger that naturally arise in play.
But many parents and educators say it feels dangerously different since the pandemic, when children may have spent some more time outdoors, but communicated and learned almost entirely through social media and their devices.
Putting kids in a room together, they're more comfortable messaging each other on their Chromebooks or messaging on their phones than they are turning and talking to their person next to them.
Gray argues kids are more stressed at school.
We've taken away a lot of recess, we've shortened the lunch hour so kids are gobbling down their food.
We're all trying our best, right? But sometimes you can have good intentions and it doesn't turn out the way you want it.
Researchers, parents, and teachers agree something needs to change if the goal is confident and communicative kids. Julie McDonald, CBS News, Boston.
A group of doctors is supporting bans on advertising junk food to kids. The American College of Lifestyle Medicine says it backs the Childhood Diabetes Reduction Act, which would also require warning labels on ultra-processed and sugar-sweetened food and drinks. The group says 1/3 of children are overweight and diet is to blame. But this week, the U.S. Department of Agriculture decided chocolate milk can stay on the school lunch tray. The Biden administration initially sought a ban on flavored milks to reduce children's consumption of added sugars. Instead, the USDA will enforce a limit on added sugars in flavored milk starting in the fall of 2025. What do Prince William, Oprah Winfrey, Justin Bieber, and Jerry Seinfeld all have in common? They're all lefties. And they're in the minority in this mostly right-handed world. So just what determines our dominant hand? As Kirsten Mitchell reports, it may be part nature, part nurture.
Raise your hand if you write with your right hand.
There's no right.
Now raise your hand if you write with your left hand.
Or wrong answer.
All right, 1, 2, 3, 4,
These second graders in Columbia Heights just know what feels right.
It actually feels comfortable, but when I write with my right hand, it feels uncomfortable and I can't write correctly.
About 90% of people are right-handed, while 10% are left.
Some of the theories think that it's because of the way our brains are wired.
Dr. Nancy Siegel says lefties often have a more dominant right side of their brain, while righties have a more dominant left. Why, though, is still a mystery.
Language was a very, very important development in human history. And of course, language is in the left hemisphere, and that might strengthen the right hand.
Studies show which hand is dominant may be influenced by genetics, adverse birth events, or even random chance.
Handedness does seem to have a genetic component that is inherited, but there's no simple pathway from parent to child that we're able to figure out.
Dr. Nicola Grissom says evolution could also have a role.
Best guess for what we have about left-handedness is it provides that level of flexibility for future adaptation.
While left-handedness has become more accepted over the years, lefties still live in a right-handed world, and that too is an influence.
There's been a long history of people being left-handed, training themselves to be right-handed.
Dr. Siegel says there's no need to feel left out when lefties stand out.
They may have certain attributes, certain ways of processing information that is unique and distinct.
Kirsten Mitchell, CBS News, Columbia Heights, Minnesota.
Coming up, teens are helping reach other young people with a suicide prevention campaign, and how one couple's 10-year journey to parenthood made them advocates for IVF access.
The chaos and confusion from overturning Roe has disrupted access to fertility treatments for families who are desperately trying to get pregnant.
Welcome back. All facets of reproductive care, including fertility treatments, have fallen under the political microscope since the Dobbs ruling nearly 2 years ago. This is National Infertility Awareness Week, a chance to highlight the struggles some parents face trying to have children. We spoke with Luisa and Will Lopez about their decade-long journey to parenthood. Becoming a parent, you guys didn't have an easy journey with this.
We had been trying for 10 years to become parents.
Those first few years, we always said, oh, we're just, taking our time. But when it got down to trying, we started to realize pretty early on that, there was something not right.
We tried IUI, it did not work, and then we moved into IVF and did 8 cycles of IVF before we were successful in having our son.
8 cycles. Emotionally, it has to be a lot of ups and downs for you.
Yeah, I mean, it's a terrible process when you think about it. You never know how long it's going to take. We committed to each other early on that, we're going to do this together. I gave her every single shot. Over the course of 10 years, I think we estimated somewhere around almost 1,500 shots.
It's an emotional roller coaster. And if you are not in a position where you're comfortable speaking about it or sharing with people, it can be very isolating and lonely.
We suffered 2 miscarriages during the process, one at 6 weeks, one at 12 weeks.
I took an emotional break because it did get to be too much. So finally we decided, okay, fine, let's give it a shot, like they say. And it worked. And nobody is more surprised than me.
the more you talk about it, the less the stigma, is there. You're carrying less of a burden.
It's a lighter load to carry when you are open about it. More people than you know are experiencing family building struggles.
So can we meet Lucas?
Yes, for sure.
All right. Hello, buddy.
Hi, baby. Hello,
This is
baby.
Lucas. Say hello. He's 6 months old. He is the light of our world.
For us to see him here and have him here, it's a blessing.
The amount of happiness that we have gotten just in this short amount of time, everyone has right for that. No one should dictate, how you become a parent. And proof's right here.
Well, again, thank you both, and thank you, Lucas, for sharing your story.
Thank you.
Thank you so much.
Suicide continues to be a leading cause of death for young people in the U.S. It's a serious public health concern that has officials across the country trying to figure out ways to fight it. Dominic Garcia shows us a new campaign that dozens of teens helped create.
I hope that this campaign lets people know that they don't have to struggle on their own.
Shaylin Dawkins knows suicide is a huge problem. So when he heard about the Never a Bother campaign,
I was all in from the second I heard about it.
he is one of more than 400 young Californians that shared their thoughts, feelings, and perspectives in how to best reach a younger generation.
We really had a say in, how the campaign looked and the messaging, even down to, simple things like the colors on the website or how the website even flowed.
Youth are their best spokespeople. You really need to give them the equipment and the resources, and they will help create those prevention messages.
Matt Cervantes is with the Sierra Health Foundation, one of the organizations involved. He says the campaign will be pushed out via traditional advertising, social media, and even use community outreach strategies. The big focus will be on populations they say are disproportionately impacted by suicide.
And that's the beautiful part about this campaign. It's youth-centered. It's providing and meeting young people where they're at.
There have been a lot of times, especially when I was younger, when I just didn't know what to do. I didn't know what resources to point them towards. And I think that this campaign is vital because it allows people a gateway to resources.
The hope is this gives youth a message that there is help out there, that they deserve it, and where to find it. Dominic Garcia, CBS News, Sacramento.
Former Miss USA Chesley Christ finished the manuscript for her first book shortly before she died by suicide in 2022 at age 30. By the time you read this, the space between Chesley's smile and mental illness is on sale now. Her mother, April Simpkins, saw that it was published. She says her daughter battled severe depression for years and says anyone who's struggling needs a support system.
Whether that's your good friend, your counselor, family member, clergy, whoever that is for you, you need that person who really can meet you where you are so that you don't have to constantly wear that mask.
If you or someone you know is seeking mental health resources, you can contact the National Alliance on Mental Illness helpline. After the break, Americans are staying younger longer, at least in their thoughts. And April is Donate Life Month. We hear from a grateful organ recipient. Welcome back. It seems age really is just a number. A study published by the American Psychological Association shows that middle-aged and older adults believe old age begins later in life than their peers did decades earlier. And as individuals aged, their perception of old age was pushed further out.
I think it is a mindset. I think if you keep yourself active and you open yourself to new opportunities and keep trying new things, you're going to feel younger.
If for any reason I have to limit what I may have wanted to do, that would make me feel old.
German researchers say increased life expectancy may contribute to this youthful perception, along with later retirement and some improved health aspects. British scientists are drumming up support for new research to help ease symptoms of Parkinson's disease. They say samba music helps improve patients' moods and movement. Ian Lee listens in.
Keeping to the beat of life can be a struggle, especially with Parkinson's. But these patients are finding a new rhythm with samba.
When you hear a samba band in the street, you can't help but going to do.
Arwen Mallon founded the samba band Sparky in Wales to help herself and other Brits battle a disease with no cure.
You wait ages for somebody to come along and wave a magic wand, but if it's something you can do yourself, then that's really, to me, that's really important.
Parkinson's is a degenerative disease that affects the body's movement and can lead to dementia. In 2013, a doctor told Ken Howard he had just a few good years left.
I thought to myself, nobody tells me what to do like that. So that was about 11 years ago.
Scientists want to help more people live better. Over the past year, samba drummers reported improved mood and movement, but researchers want clinical evidence the music eases symptoms.
And that is one of the reasons that we're doing the trial, trying to tease out those complex mechanisms and understanding, is it actually the drumming itself?
Brian Dew says he doesn't need a scientist to tell him what he already knows.
But I think without samba, I think I would be struggling.
But researchers believe their year-long study could be instrumental in treating Parkinson's patients in the future. Ian Lee, CBS News, London.
April is Donate Life Month, spreading the word about the importance of registering as an organ, eye, and tissue donor. Now, technology is helping make more organs viable. Bradley Blackburn introduces us to a liver transplant recipient who's forever grateful for the gift that saved his life.
World-renowned ornithologist Eduardo Inigo Elias can't wait to get back to doing the job he loves, studying birds. A gift from an organ donor has given him a second chance.
So thankful, number one, for the organ donor and his family. I want to thank him for this opportunity to extend the lease of my life, and my family is very grateful.
Eduardo had severe liver cirrhosis from non-alcoholic liver disease. He spent more than 6 years on the transplant list waiting for a new liver.
Deteriorating and getting sicker.
When the call finally came that a donor liver was available, doctors determined the organ's fat content compromised its viability.
We try to use every organ, but there are certain organs that can't be used, like a fatty liver, like an older liver.
Dr. Leona Kim Schluger is the Associate Director of the Recanati Miller Transplantation Institute at Mount Sinai, where surgeons used a new technology called organ perfusion on the donated liver.
This machine allows the organs to be literally cleansed. You're putting in nutrients, you're putting in oxygen, you're measuring the viability of the organ. It allows us to use many more organs, and obviously the more organs you have, the more lives you save.
It's been more than a year and a half since Eduardo's transplant, and while he's had some complications, he's very grateful.
I just took a 45-minute walk in Central Park, birding. I don't have any more complications. My medications are working, my liver functions are normal, my energy is back, everything is just perfect.
And he hopes sharing his story encourages more people to sign up to be an organ donor. Bradley Blackburn, CBS News, New York.
If you'd like to donate, go to the National Donate Life Registry at registerme.org. Anyone 18 and older can register to be an organ, eye, and tissue donor. That's this week's Eye on Health. I'm Michael George. Thanks for joining us, and be well.